For all your medical questions, turn to the experts, East Cooper Medical Center.
Factors that should matter the most to somebody when they're deciding to have a hip or knee replacement should be finding a procedure and technique that are going to last as long as possible and give them as quick of a recovery as possible. There are several ways to accomplish this. One is the type of implant that's chosen and the track record of that implant. Secondly, the technique, how precisely the implant is placed, whether that's with or without computer navigation. And the third factor is how the surgery is done itself, the ability to do, for example, knee replacement without using a tourniquet. As you can imagine, if you were to place a string around your finger for an hour, it would be extremely painful. And the same thing happens when you have surgery on your knee. If you have a tourniquet blocking the blood flow to your leg for an hour, for example, that can be extremely painful. And we think without the use of a tourniquet, the recovery is quicker. There's potentially less risk of a blood clot. The infection risk, we think, should be less. So there are several advantages that allow for a quicker recovery and also allow for perhaps a longer lasting construct. We like to have people up and around the day of surgery. We have some techniques, whether it's a partial joint replacement or performing, for example, knee replacement without a tourniquet, that allow for a quicker recovery, less pain, and earlier motion after surgery. One of the most important factors in the success of a joint replacement is what happens before the person actually gets to the hospital. We have a very dedicated team, including therapists, nurses, internists, and ourselves, who do a very thorough evaluation before surgery is performed to be certain that the patient is in optimal shape before surgery, which decreases the hospital stay and significantly decreases the risk of a problem after surgery.